Welcome to another edition of EDTalks. Super excited because we have a president and CEO with us, and I want to introduce you to Paul Hiltz. Paul, welcome to EDTalks.
Good morning. Thanks for having me.
Yeah, Paul, this is really exciting because you and I, we do have some connections, previous connections. We both served at Cleveland Clinic, and we both have a long history in mid and northeastern Ohio. But you were the smart one in terms of leaving and it's a lovely place, so nothing bad about Ohio. But when it comes to the weather, you left for much warmer weather in Florida. Tell us about that transition.
Well, so I love Northeast Ohio just like you do, other than the winters, which is going on right now. Down here today in Florida, it's sunny, 70 degrees. And so that does make it this here. Great organizations in Northeast Ohio. It's a great healthcare region. And I came to Florida for another exciting challenge here at what we now call Naples Comprehensive Health. So I've been here about 5 years, making a lot of progress and excited about the future here in Southwest Florida Health.
Yeah, and tell us, we jumped right in because of our connection to Ohio, but tell us a little bit more about yourself in terms of how you got into healthcare and a little bit about the service that you've done. And again, a lot of it is Northeast Ohio, but take us all the way to where you are today with Naples Comprehensive Health System.
Well, yeah, we're out of undergrad. I went to the Xavier Graduate Program for Health Administration and have been in healthcare ever since. I started on the physician side of things, running group practices, recruiting doctors, forming joint ventures with doctors, and really learning to see healthcare from a doctor point of view. And it turns out that that's been very helpful to me in my career because I went from there to running physician hospital organizations, running one of the first ACOs, or accountable care organizations in America, which was part of Obamacare. And then got into hospital leadership about 15 years ago. And I've now run, I think, 4 different hospital systems, and I love the hospital side of it. And my real theme right now is to make sure that, there's an old saying that says, if you're not at the table, you're probably on the menu. And I keep telling doctors, it's time for doctors to get to the table to be really driving healthcare change, healthcare delivery in America. That's my mantra here at Naples. We really are working doctors in the lead here to create a compelling future for this region.
Yeah, I love that. And I'm sure your medical staff does as well. So you head down to pre-pandemic, but the pandemic little did we all know, the pandemic was about to start. And not only were you wrestling with this new organization, but as I understand from reading the book, that sort of got you ready to handle that pandemic. So the book that we're talking about, and we can see it on your table there, is Upheaval, Crafting a Culture and Managing Your Message Through Crisis. So tell us about, what happened when you first arrived at NCH, and then COVID, and then the book.
Well, when I arrived here, there was significant unrest here, mainly between the doctors and the administration here, but also the community had really lost some confidence in NCH. And my job was to come in and build relationships with doctors. And I came in talking about building pluralistic medicine, meaning I don't have a preferred model of only employed doctors or only independent. I just said, I want great quality doctors to work with, whether you're employed or independent, help my care. And then I just began to listen to the doctors in terms of what was going to take to build a high-performing health system. Then is right when COVID hit, so that listening tour really turned out to be fortuitous because I got to know a lot of the community leaders, community members, doctors, elected officials. As we went into the pandemic, that turned out to be very lucky because we were able to partner with the city of Naples, with county government, county health departments, and the medical staff to try and keep our employees safe and to try to keep Southwest Florida safe. And it was quite an experience.
Yeah, it makes total sense. And so you learned a lot from this, and that led to the book Upheaval. What are 2 or 3 takeaways that you want individuals who read the book to come away with?
Well, I'm a hospital operator or an operator by background. And so one of the key takeaways, I partnered, my co-author of this, a woman named Hiltz, who's really one of the pros in the United States price of communication. And I've encouraged my colleagues, don't think that as an operator you can do this by yourself. I just believe now, having gone through this, the key to this was to partner with an expert communicator, because there was so much misinformation, so much confusion, so much fear. The only way to really get at that, as we were making operational changes, how do you continue to communicate in a way that reassures people and educates people in a situation that was really just evolving from day one. That to me is one of the big takeaways, is to make sure communications is not an afterthought, but is a key part of your strategy.
Yeah, makes total sense because I think you're right. A lot of times, whether it's healthcare, I think this book and the message of the book is apropos for even outside of healthcare. A lot of times we don't proactively plan for effective communications, and so we're caught flat-footed. And of course, then we're under a lot of stress and duress, and so we don't necessarily make the best decisions. And so the book's super practical, like things you should be thinking about and can do ahead of time, so that when that crisis does, and it always will, right, Paul? There's always something that comes up.
There's a if you've been in healthcare as long as you and I have, you know that it's a couple of years, it's something new, but it's something we haven't seen before. And I think you'll agree, not only in healthcare, but just in leadership in corporate America, there's been a lack of trust now coming out of the pandemic. If you look at the data from Gallup, employee engagement, so forth, employees have sort of lost connection with their leaders. And we need to, as leaders, whether it's in healthcare or corporate America, we have to work really hard to rebuild or build for the first time trust with our workers. And one of the key ways to do that is to have a very transparent communication style, where we really lay out everything we're working on and make sure we're answering the questions of our employees, our frontline workers, so that they feel comfortable, feel engaged, feel energized about the work that they're doing. And that's something I'm really passionate about right now.
Yeah, I like that. So your book, currently #1 bestseller for hospital administration. How was the process of writing the book? Is it something that you enjoyed that you would recommend for other?
I really enjoyed it. It's something that I always kind of wanted to do, but didn't really thought I had the time. But it took me a little longer to do than I thought. It probably took about 10 months start to finish. And I give so much credit to Amanda Lucy for doing so much of the work on it. But in hindsight, it was really a really neat experience to go through. But I sat back and looked at all we had been through from the time that I started here, because the pandemic hit, I think, 4 months into my tenure here. Who could have ever predicted that I'd run into something like this in Florida?
Right. Yeah, it's crazy times for sure. But I think out of all the challenges and difficulties that the pandemic brought about, the the nice thing, if there is a silver lining, there's several of them, but just what you learned and are sharing in this book, Upheaval, I think is really going to help a lot of people in the future. So hopefully it's not a pandemic, but there's other issues, as we alluded to, that always come up. And because that's the nature of life and the business that we're in. And so it's best to be well prepared. So Paul, where can people find your book?
The easiest way is just to go to Amazon. It's on Amazon. It's easy to buy in the electronic or the hardcover version. And we've gotten a nice reception from the book. And it's just been fun for me to reconnect with colleagues I've worked with like you throughout the United States and kind of share ideas.
Yeah.
And hopefully it's helpful. It was fun to do the project. And I'm really still enjoying healthcare leadership. I think right now, artificial intelligence, all the advancements in terms of drugs and technologies, it's a great time to be in health.
Yeah. Completely agree with that, Paul. And I just thank you for the book, because like we established in the beginning, kind of the why around the book is oftentimes where we are caught flat-footed as leaders, and then we're, trying to manage the situation that we find ourselves in. And it's hard to have that clear thinking and taking that time to think about communications, because we're trying to put out a fire. And so being proactive, and it's a message, like we said, for everyone in and outside of healthcare, just to be super well prepared. So I highly recommend the book. And I'll also drop the links to the website so that individuals listening can order right away, because I think it's going to be super, super helpful. Paul, thank you so much for being my guest, and thank you for the service that you're doing for not only in Northeast Ohio, but now in Florida.
And thanks so much. Congrats to you on this educational cast. And I'm excited to be a part of that and grateful to you. So thanks again.